Welcome to our guide on Medicare premium costs for 2025. Staying informed about healthcare changes is essential, and in today's video we'll break down the 2025 Medicare premiums to help you plan confidently for the year ahead. Whether you're a Medicare beneficiary, caregiver, or just interested in the updates, this resource will simplify what you need to know. So let's dive in. Hi everyone, I am Michael Ferrara, your dedicated Medicare agent. My goal is simply to help you understand your Medicare benefits so you can make informed decisions about your healthcare coverage. At our agency, we believe education builds lasting relationships. That's why we focus on making Medicare clear and easy to navigate. If you have any questions or need assistance after watching this video, please feel free to email me directly at mferrara@ferraraservices.net. I'd be happy to help. Now let's dive into the 2025 Medicare premiums, starting with Medicare Part A, which covers hospital admission. For 2025, the Part A deductible is $1,676, which is a $44 increase from last year. Now keep in mind, this deductible isn't an annual fee, it applies to each benefit period. So you might be wondering, what is a benefit period? Well, it begins the day you're admitted into the hospital and it lasts for 60 days. So for example, if you're admitted and then discharged after 7 days, that 60-day benefit period continues. Any hospital visits within those 60 days counts toward the same deductible. But if you're admitted again after the 60-day period ends, a new benefit period and deductible begins. So it's possible to face the Part A deductible more than once in a year. So for hospital stays, here's how costs break down in 2025. During the first 60 days, your maximum cost is the $1,676 deductible, as Medicare covers the rest. From days 61 to 90, the daily hospital cost is now $419 per day, which is an $11 increase from last year. From days 91 to 150, the cost per day has risen to $838, which is up $22 from 2024. Now after day 150, Medicare no longer covers hospitals' costs, and you're going to be responsible for all the expenses. These changes make it crucial to understand and plan for possible hospital stays. Medicare Part A also covers a range of services provided by skilled nursing facilities, also known as SNFs, under certain conditions, of course. Skilled nursing care is often needed after a hospital stay to assist patients in their recovery. Let's go over some key points to understand how this works. To qualify for Medicare-covered skilled nursing care, you must have been hospitalized for at least 3 consecutive days. This is called the 3-day hospital stay rule. Additionally, your doctor must confirm that skilled nursing care is needed and that it relates to the condition you were hospitalized for. Medicare typically covers the full cost of care for the first 20 days in a skilled nursing facility if you meet the eligibility requirements. From days 21 to 100, there is a daily copayment. In 2025, that copayment is $209.50 per day. Now, Medicare only covers care that is considered skilled. This simply means it must be provided by a licensed medical professional, like registered nurses, physical therapists, or occupational therapists, offering a higher level of care than what's available at home or in a non-skilled nursing facility. Understanding these details can help you better navigate Medicare's skilled nursing benefits and plan for potential costs down the road. It's important to know that after day 100, Medicare coverage for skilled nursing facility care ends. From this point on, any further care in an SNF must be paid for out of pocket or covered by supplementary insurance. Medicare will cover skilled nursing care as long as it meets their criteria and is required for recovery. However, it's important to remember that Medicare focuses on rehabilitative and restorative care, not long-term custodial care. Each stay in a skilled nursing facility is evaluated individually, so coverage will depend on your ongoing need for skilled care. Keep in mind that coverage can vary from case to case. Medicare considers factors like the patient's condition and the care plan set by the medical team. So not all skilled nurse care is the same, and individual circumstances may influence your coverage. So to summarize, Medicare Part A provides skilled nursing facility coverage for eligible beneficiaries, and here's how the cost structure works. The first 20 days, Medicare covers the full cost. From days 21 to 100, there is a $209.50 daily copayment in 2025, which is an increase of $5.50 from last year's $204. After day 100, you are responsible for all costs as Medicare coverage ends. As you can see, coverage specific and costs can change each year, making it essential to stay informed about the latest updates to your Medicare benefits. Now let's shift our focus now on Medicare Part B, which covers a wide range of essential outpatient medical services. Understanding Part B costs is crucial for all Medicare beneficiaries. So let's take a look at the updates for 2025. The standard Part B premium for most seniors has increased from $174.70 to $185 per month in 2025, making a $10.30 increase. It's also important to know that some beneficiaries may pay higher premiums based on income, as Medicare uses an income-based system for Part B premiums. The Part B deductible, which you must meet before Medicare covers your outpatient cost, has also increased from $240 to $257 in 2025, which is a $17 increase. This deductible is an annual cost, so it's essential to budget for it as your initial out-of-pocket expense for Part B services. These updates highlight why it's so important to stay informed about Medicare costs and understand how they may impact your healthcare expenses. Medicare is designed to provide access to necessary services, but it's adjusted each year to account for various factors. If you have any questions about income-related premiums or how these changes may impact your budget, please feel free to leave a comment below or reach out to me directly at mferrara@ferraraservices.net, as I'm always happy to help. Now let's dive into Medicare Part D, which covers your prescription drug expenses for 2025. This year brings some significant changes, so let's go over what is new. First, the maximum deductible that any insurance provider can charge you has increased to $590, which is a $45 jump from last year's deductible of $545. And unlike previous years when this deductible only applied to tiers 4 and 5 drugs, most carriers now apply it to tier 2 and higher. This change makes it more important than ever to review your Part D benefits to ensure you're on the best plan to meet your needs and avoid unnecessary out-of-pocket costs. If you have any questions, don't hesitate to reach out to me directly at mferrara@ferraraservices.net. Now let's talk about how initial coverage works. Once you meet your deductible, you'll be responsible for 25% of the cost of your prescriptions, while your Part D plan covers 65% and your pharmacy covers the remaining 10%. This phase lasts until you reach $2,000 in total drug costs. Now here's the big news for 2025. The donut hole or coverage gap has been completely removed. Once you reach that $2,000 limit, you skip straight over the donut hole and you move straight into your catastrophic coverage. That simply means for the remainder of the year, your prescriptions are going to be covered at 100%, which means no cost to you for 2025. But here's something important to keep in mind. With the donut hole removed, those costs have to be covered somewhere. For 2025, more Part D plans from last year are being discontinued, so you may see changes in your monthly premium if you stick with your current plan. It's essential to review your options closely to avoid unexpected costs. Now here's the good news. Some Part D plans offer a $0 monthly premium and a zero cost for all drugs in 2025. However, choosing the right plan and the right pharmacy can make a significant difference in some cases. Switching pharmacies could save you hundreds or even thousands of dollars next year. Medicare.gov is an excellent resource to compare Part D plans. I'll link to a video I made a few years ago that will walk you through how to use Medicare.gov tool to find the best plans for you. Now let's talk about Medicare Advantage plans, also known as Medicare Part C. These plans have evolved and improved over the years, offering a private insurance alternative to original Medicare. Let's take a closer look at how they work and why you might consider one. Medicare Advantage plans are offered by private insurance companies, not by Medicare itself. They provide an alternative to original Medicare's traditional fee-for-service structure. One essential thing to know is that benefits and provider networks in Medicare Advantage plans can change each year. This dynamic nature makes it crucial to review your plan annually to ensure it still aligns with your healthcare needs and preferences. By reviewing your plan each year, you can confirm that your preferred doctors and hospitals are still in your network. You'll also be able to see if the benefits have changed or improved, helping you make the most of your coverage. Staying informed is key to getting the best value out of your plan. Now, Medicare Advantage plans continue to expand their offerings each year. Many plans now include additional benefits like dental, vision, and prescription drug coverage, making them an attractive choice for many beneficiaries. Whether you're already enrolled in a Medicare Advantage plan or considering one, an annual review can help you stay on top of many changes and maximize your benefits. Let's take a closer look at Original Medicare paired with a Medicare Supplement plan, also known as a Medigap plan. While Medicare Advantage plans have their perks, many individuals prefer the flexibility and freedom that come with Original Medicare combined with a Medicare plan. The case for Original Medicare and Medicare Supplement plans, with this combination, you can see any doctor or visit any hospital that accepts Medicare, with no network restrictions. Plus, your doctor retains full control over your healthcare decisions rather than an insurance carrier, allowing you and your physician to make the best choices for your care. Now, it's important to note that we can only discuss Medicare Advantage plans with you if you specifically request information and you complete a scope of appointment. This document ensures that discussions about plan details and benefits are initiated at your request. If you have questions about Medicare Advantage plans or are currently enrolled in one, feel free to reach out. You can send me an email or leave a comment below to schedule a no-cost review. I'll email you a scope of appointment to be completed beforehand, which can be filled out digitally through a secured link. For those with Medicare Supplement plans, you have year-round flexibility to make changes as your healthcare needs evolve without waiting for enrollment periods. In summary, Medicare Advantage plans offer a dynamic alternative to Original Medicare, but they require regular review to ensure they align with your healthcare preferences. Ultimately, the choice between Medicare Advantage and Original Medicare with a Medigap plan depends on your individual needs and preferences. So as we wrap up, I hope you have a clearer picture of what to expect from Medicare in 2025. Thank you so much for joining me today. I do truly appreciate your time, and I hope you found this video both informative and valuable. If you haven't done so already, please consider sharing this video with friends and family, and don't forget to subscribe to my channel to stay updated on all things Medicare. Again, my name is Michael Ferrara, and I am honored to be your dedicated Medicare agent. My mission simply is to help you understand your Medicare benefits fully and ensure you're never overcharged for healthcare coverage. It's a true privilege and honor to serve you in this role. If you have any questions, concerns, or need assistance with Medicare benefits, please don't hesitate to reach out. You can email me directly at mferrara@ferraraservices.net. And remember, our services are always 100% free to you. Like your auto or homeowner's insurance, we're compensated by the insurance carriers only when you choose us as your trusted Medicare agent. Thank you again for watching. I wish you a fantastic day ahead, and I look forward to talking to you very soon. Thank you again. I appreciate you, and I hope you have an amazing day. Bye-bye for now.